Hello students, today we will discuss how to do vertical mattress suture. Now vertical mattress suture is very commonly used, especially in surface, especially in the skin, so that it attains a proper wound eversion, so that it won't get inverted and wound deposition will be better. So here initially take a usually cutting needle for the skin, otherwise round body needle used in the deeper plane. Cutting needle is taken and placed into the needle holder in the center of the needle and proximal to the distal 1/3 of the distal jaw of the needle holder. Always lock the needle holder, then take needle bite of the entry point perpendicular to the tissue, otherwise it will not be able to negotiate properly. Then after that come out of the wound, then take the exit point by to the needle to using the needle holder. Once you do that, again don't put the knot like in a simple. If you put the knot, it becomes simple suture. But here reverse the needle in the opposite direction. Then through the reverse method, you take the bite from the very close cut edge of the wound of the exit point wound. So initially entry point wound, then edge, then exit point edge. So entry point, exit point, then closer near entry exit point you have to take bite for the both edges. Then it will go back to the your needle and suture metal will go back to the initial entry point. There you place a knot. Initial surgeons, first loop, second loop, third loop, minimum 3 knots you have to place. So this is called far, near. And similarly, other way also you can do. You take a near bite from the entry point close to the margin, from the entry point, exit point. Then from the exit point, go back to the far bite, near, far, and far again far bite to the entry point, exit point, and entry point. Then put the knot. So commonly done is far, near, far from the entry point, far from the exit point, near from the exit point, near from the entry point. Then put the knot. It can be near, far also. So I will demonstrate how exactly both being done. So students, I am demonstrating how to do simple vertical mattress. So same thing, need suture material I am using polypropylene proline 20 round body needle, and needle holder I have placed proximal to the distal 1/3. I have locked needle holder. I will take the bite from the entry point perpendicularly like this perpendicular, important. Then bring the first one, always bring entry point separately, remaining thing you may take. Always pull adequate length so that we keep the trail and or tail short, so that save the suture material. Then I will go for the exit point like this. So again pull it out like this. See that? Now you got a bite you have taken. Now mattress suture you have to put. Now you got a. Now you have come from here to here. Now you have to take bite from the very close edge like this. So far. Now near. So otherwise called as far, near. Like this. You'll take it out one by one. You can do. Oh, that's it. That's fallen. So it has come out near. Now after that, see that, take the bite like this in the same opposite side. near bite you take like this, like this. Like this. So this is trail end, bait, leading end, far, far, near, near. First far bite, near bite, near bite. Then put the knot. I am putting the surgical knot. I'll square it, then put the lower one, reef I'll put the reef knot, front, back. So this is how exactly we will do the mattress, vertical mattress. It's called as vertical mattress, not horizontal mattress. This is called as vertical mattress. One more similar vertical mattress I will show you so that you will have the idea. I will take bite like this. I will take a little away like this. Pull it down. Then similar distance away, pull it out, far, near you have to do. Then near I am putting. First far, next near. Near I have taken bite. See that? Near I have taken. Then this is how. Then put the knot like this. I am not showing the knot. This is how exactly. Far, equal distance. Near, far, near. Now another method of placing the vertical mattress is first to take near. Like this. This is another way. First to take near bite. Near bite I am taking. First you take near bite. This is another method. So near you take first. That is not commonly practiced, but a few surgeons do that. Near bite you take. Then you take the far bite from this side. For take like this. Take like this. Take like this. So this is the near, far. Both are vertical mattress. Commonly done is far, near. Then of course put the knot. I am putting the surgical knot. Then from behind reef knot. Then from front. Then from behind. Like this. So this is how exactly you will do the vertical mattress. Far, near, far. So knot comes to the same side of the bite. So equidistance should be there. So commonly done far, near. So students, I hope you understood the vertical mattress very well.